All right, this is part 3 of our lecture video on the lymphatic and immune system. Last time we talked about the innate immune defenses, which are parts of our immune system that are always there and always available, ready to attack any foreign particle that might enter the body. Recall from our last video that any foreign substance in the body we call an antigen. So antigens are anything that the immune system does not recognize as self. So in this diagram here, you can see the adaptive immunity is different in the sense that it uses specific cells or antibodies to attack foreign substances or antigens. So the adaptive immunity is different than the innate immunity in that with adaptive immune responses, the different cells involved have to have previous exposure to recognize and mount a good attack on these antigens. So that's why we vaccinate. That's why if we've gotten sick with a particular illness, if we get sick with that same illness again, we're not going to get sick because our body has a memory. And these cells that are involved in the adaptive immunity can mount a fast, effective response on the second exposure to some of these antigens, and then as a result we don't get sick and we have a good response and immunity to that particular illness. So there's two branches of the adaptive immunity. There's the cell-mediated immunity, and then there's the antibody-mediated immunity. With cell-mediated immunity, it just means that that antigen has to bind with a cell of the immune system and then be presented to other cells of the immune system in order to be destroyed and eliminated. With antibody-mediated immunity, we have antibodies that are formed that will bind with that antigen directly in the tissues or the blood. So when we look at, for example, this side of our diagram, the cell-mediated immunity just means that a cell has to bind to that antigen and engulf it and present that antigen to the other cells of the immune system. So the APC here stands for antigen presenting cell, and that is going to take that foreign particle, that antigen, engulf it and present it on the surface for the other cells to recognize. And the T cells are cells that respond to these antigen presenting cells and will deal with and destroy that antigen. It'll help mount the immune response. So there are 3 different types of antigen presenting cells in the body, and they are dendritic cells and macrophages and B lymphocytes. So all 3 of those are antigen presenting cells, and they help present this foreign particle to the other cells involved with immunity. So cytotoxic T cells and helper T cells are 2 important cells that will deal with antigens that are presented to them through the antigen presenting cells, and then they'll take a role to make sure that those antigens are destroyed. So any cell that is infected with an antigen, these antigen presenting cells will be phagocytosed, which means they'll be engulfed and destroyed by enzymes, and apoptosis here means those cells are destroyed. So apoptosis just is another term for cell death. So any infected cells are going to be destroyed. So another response is if those antigens are not bound to an antigen presenting cell, but they're free floating in the plasma, we have B cells that will attack those antigens and form what we call plasma cells, which are special differentiated B cells that are going to produce lots and lots of antibodies, which are these small little Y-shaped structures, which are proteins that will bind and destroy antigen. So when we bind antigen to antibodies, we take them out of circulation and they are destroyed by the immune system. So when we have antibodies present already in the plasma because of a previous exposure to an illness, then they bind to that antigen on the second exposure and a person does not become ill. So in the time that we're kind of fighting the symptoms of an illness, our body is producing antibodies, but it takes a while on that first exposure for us to produce enough antibodies to take that antigen out of circulation and prevent us from becoming sick. So that's the period of time when we have the symptoms, but the good news is on the second exposure, we're going to have those antibodies, and that will fight infection if it should come this second time. And this is particularly effective with viruses. So when we look at illnesses that are viral in nature, the production of antibodies and getting those immunizations is extra important. So this is just what an antibody looks like. It's a protein, and it's produced by B cells, specifically plasma cells that are special B cells that have encountered an antigen and are now remembering what that antigen looks like and producing antibodies specific to it. So we can see the antigen, the foreign particle, is the green structure. It binds to the antibody and then again is destroyed and taken out of circulation. So there's 5 different classes of antibodies, and each of them has a different kind of focus on what it attacks and where it's found. But IgG is the most common antibody, and we see these binding to pathogens or toxins that can enter into the plasma through the digestive tract, through infection. It's good for protecting a fetus, a developing fetus, because it can cross the placenta. So if the mother has formed antibodies to different illnesses throughout her life, that same immunity will pass through the placenta and protect the fetus as well. So when we look at the different classes of antibodies, we can see that they have, different locations, and what their functions are is a little bit different. For example, IgE is mostly secreted in response to allergic responses, allergies. So people with food allergies and allergies to different things in the environment are going to have higher amounts of IgE. Also, if a person has had a parasitic worm infection, we're going to see higher numbers of IgE in the plasma. IgA is an important antibody that is secreted in the saliva and breast milk. So breastfeeding moms will secrete IgA into the breast milk, and that will give baby immunity after birth. So that's an important antibody for protecting babies early in their life while they're breastfeeding. And then IgM is something that we form right away when we have a new infection. It's one of the quickest antibodies on the scene, and that's an important one for infections of all kinds in the tissues. So they all have, like I said, kind of a specialty and a speed with which they can fight infection. I'm not going to hold you accountable for all those details, but it is important to know there are, antibodies. They have different shapes, different structures, different locations of where they are active, and also how quickly they arrive on the scene. So when we talk about immunity, there's different terms in how we get immunity, in terms of how we get these antibodies to have a memory and recognize illnesses that maybe we've been exposed to before. So acquired immunity, which means it's an immunity that you develop after exposure, it can be active or passive. So active immunity is when we make antibodies on our own body makes antibodies against an antigen, and that can be through vaccines. When we immunize, we develop antibodies to whatever is in that vaccine. For example, the influenza vaccine, which is something everybody should get between the months of October and February. The peak season for influenza is in February, so it's always a good idea to make sure that you are, immunized early on, so we're not passing around that virus and allowing it to mutate and infect those around us that are immunocompromised. So active immunity is any time we're producing antibodies through infection with that antigen. And the antigen may be weakened or killed, as in an immunization or vaccine, or it might be active if it's an active illness we caught, at the grocery store or sitting in class or from someone at work. So when we're actively producing the antibodies on our own, we call that active immunity. So the first time we're exposed to something, we produce, a few antibodies, and then the second time we're exposed, we see a much larger antibody response and a much quicker elimination of that antigen from the body. So when we get a vaccine, the first time we get a vaccine as an infant, we have to usually come back for a booster within a certain period of time, because we find that after about a month, if we expose that child to the vaccine and to those antigens a second time, we get a much larger response, and that memory of those antibodies to that illness remains high for a longer period of time. So The first exposure, we get a little bit of an immune response, but the second time we get that booster, we get a much larger response. So it's really important that moms and parents of young children that are getting their vaccines, it's really important they follow that vaccine schedule and don't just think that it's a one and done. So we need that second exposure or that booster to mount a really good response to that illness. Passive immunity is when we don't have time to give somebody a vaccine. Maybe they've been exposed already to an illness, like for example, a rattlesnake bite is not something we want to wait for someone to build antibodies to, because they're going to die in the process or have serious complications. Also, when the Ebola virus came to the United States, we were able to save some people from death due to Ebola because we gave them active antibodies via an injection to the Ebola virus. We didn't wait for the patient to make antibodies, again, because they would die in the process, because Ebola is a very serious illness. We would deliver antibodies directly made from somebody else directly to that patient by injection. Another example of passive immunity is when a newborn is breastfeeding and getting those IgA antibodies through the breast milk. And the IgG is passed through breast milk as well. Or when the developing fetus isn't still in the mother's womb, they're receiving those IgG antibodies through the blood crossing the placenta. So those are examples of passive immunity because the individual didn't make the antibodies for that antigen, but they received them in some passive way. Again, whether it be by injection or by breastfeeding or through the placenta. So we call that passive immunity. They're receiving the antibodies that were made by some other individual. And maybe you've heard of this in the movies. We call it the anti-serum. Anytime we have some antibodies for a particular illness, when someone has been infected and we need to give them, we need to fight that infection quickly, we're going to give them the anti-serum, which are antibodies made by someone else. So again, crossing the placenta, breastfeeding, or giving it by injection, that is our three routes for this passive immunity, where we give, so in each of these cases, the individual that is receiving passive immunity is receiving antibodies made by another individual. Sometimes we see hypersensitivity reactions, which means the immune system is overacting and causing widespread inflammation and symptoms, and that can result in death. So we see that when we give somebody the wrong blood type, when we have a person receiving an organ transplant or a tissue and their body rejects that, or in some of the autoimmune diseases, for example, type 1 diabetes, multiple sclerosis, lupus are examples of some diseases where the body attacks itself rather than seeing the body as safe and appropriate and the immune system only attacking foreign antigens. The immune system is turned on and attacks self-proteins. So we'll talk about some of these. So allergies are just a perfect example of benign things in our environment that shouldn't cause inflammation and an immune reaction, but for some reason does. So seasonal allergies like hay fever, there's pollen from different plants and trees and grasses in the air, that when they enter the air it causes a lot of symptoms of sneezing, asthma, runny nose, itchy eyes, itchy throat. Certain foods, we know that peanuts are a very highly sensitive protein in which some people are allergic to, and it amounts that immune response, that inflammatory response. Animal hair, people that are allergic to dander, it's not specifically the hair, but it's the dander that is of antigen that is part of the skin of animals. The more animals shed, the more dander they typically produce. But these are things that normally would be not harmful in the environment, but for some people, their body mounts an immune response to those particles. So we see, again, IgE antibodies are most affiliated with overactive immune responses, as well as basophils, which is another immune cell. And we find that they release histamine, which causes capillary dilation, so it causes runny noses and inflammation, itching. And when we look at, trying to counteract these, we have to look at medicines that are antihistamines. So some of the popular antihistamines you've heard of probably are like Allegra. There's a whole bunch. Loratadine is a really popular one. Cimetidine is another one. Zantac. You know, there's generic and brand names for those antihistamines. So we're basically trying to prevent the production of histamine, which will prevent some of these symptoms. So with asthma, the airways, the smooth muscle of the airways are constricting and causing difficulty in air movement. And some people with food allergies don't get the typical hay fever symptoms, but they're going to get vomiting, nausea, diarrhea, stomach cramping. And some people will also have constriction of the airways, and that's a very serious condition where people have died if they don't have an EpiPen or epinephrine. Epinephrine is a way to counteract that sudden immune response. So anaphylactic shock is when we get that allergen or the antigen enters the bloodstream, and then we see a drop in blood pressure and narrowing of the airways, like we said. And if we have an EpiPen available, that can counteract that reaction. So it's really important. Anybody who's at risk for anaphylactic shock, particularly people with food allergies or allergies to bee stings, they definitely want to make sure they have that EpiPen available and ready to use at any time. It is a very expensive drug. It's something that we're working on as a country, working with the pharmaceutical companies to try to bring that price down, but we're not having much luck right now. The last I heard, it was over $300 for an EpiPen. So for people that don't have good insurance, that's oftentimes out of their ability to pay, and that puts a lot of people at risk. They would just need to be near a hospital or, within a reasonable distance of an ambulance to have access to an EpiPen should they have difficulty breathing or have anaphylactic shock. So sometimes we have delayed allergic responses, and one of those is poison ivy. Some people can be walking through poison ivy and not realize it until a few days later. They start to get itching, then they have the heavy patches and flaking of poison ivy, and that's just because it takes a little time for that immune response to kick in, and then they have the rash of poison ivy. For people that are getting, lung transplants and heart transplants, they need to take drugs every day to suppress their immune system so those foreign tissues aren't attacked by the immune system. So with that, taking immunosuppressive drugs also is going to suppress general immunity, so those patients are a little more at risk for general infections and immune suppression. So we have to be careful, again, making sure that we're getting our flu shot and we're not putting our patients at risk that maybe are taking immunosuppressive drugs, that we're not bringing these illnesses that could lead to death, we're not bringing those to the bedside. So that's why if you're going into healthcare or you're working with people closely, large populations of people closely, it's really important that we that we get ourselves vaccinated against these common illnesses that in the immunosuppressed can cause death. So have been some attempts to use tissues from other organisms, from an animal. We call that xenotransplantation. A good example of that are valves, heart valves. Some people have heart valves that were taken from pigs. So we find that humans and pigs share a lot of similar cells and tissues in terms of the ability to transplant. So when the heart valves wear out, rather than using an artificial or mechanical valve, some people have used pig valves. But again, the risk for rejection is there because it's a foreign tissue and needs close monitoring after being used in those patients. Sometimes we have people with an immunodeficiency, and it's something that they're born with, and as a result, any infection can mount any infection can lead to death because those pathogens increase in number and there's no immune response to prevent that proliferation of those antigens. So when a person gets a minor cut, those bacteria in that cut can spread to the bloodstream, and grow very quickly in the bloodstream and lead to death. So when we look at people that are immunodeficient, it's a very serious condition, because anything minor that our immune system can take care of right away, those infections in the people with immunodeficiency can rapidly grow out of control and cause death. Some examples of immunodeficiencies that we've heard of in the media and have been around for a while now is AIDS, which stands for Acquired Immunodeficiency Syndrome, and that happens when the HIV virus enters the body through a break in the skin. So that could be through intercourse, it could be through IV drug use. We know it can happen. There's a slighter chance during childbirth, but it also is passed through breast milk. So breastfeeding moms can transfer the virus to their babies. But it's most commonly through a break in the skin, where we see it here in the U.S. So IV drug use and intercourse, male, female, or otherwise male on male, female on female, if they're infected, the risk is always there if there's a break in the skin. So very important that people know their status and take appropriate steps to prevent transmission. So basically this virus invades the T cells, and when the virus invades the T cells, it destroys them after a period of time. After about 10 years of infection, we find that the T cells eventually are destroyed by the virus, and then they lack an immune system, and the patients with AIDS will die of just common immune diseases that our immune system would normally be able to fight off. People with AIDS are not able to fight off those common illnesses, and they eventually die from those. And we'll talk more about that at the end of this section. So autoimmune diseases are when T cells or antibodies that normally should leave self cells alone, they see these cells as foreign. So for example, rheumatic fever is when we have a strep infection that has not been treated properly. It leads to scarlet fever, and then it can lead to rheumatic fever. And that's where the antibodies to the strep bacteria start to attack heart muscle, and it can damage the valves and the heart itself and lead to chronic heart disease because of damage from the body's own antibodies against strep starts to attack the heart muscle and valves. Sometimes we see antibodies attacking the joints. In people with rheumatoid arthritis, antibodies are formed that attacks the joints and the connective tissues and causes swelling and deformity in the joints. And that is a chronic illness that some people face. And again, to treat that, we have to suppress the immune system. Here's an example of a person whose joints have been damaged by their own immune system, damaging the joints and causing that deformity. Lupus is another one. It causes the body to produce high levels of anti-DNA antibodies. So what happens is all body cells have DNA, so when all the body cells are being attacked by these antibodies, we see, system-wide symptoms of lupus. So it's called systemic lupus erythematosus. So we see, facial rash, they get a butterfly rash on the face, fever, joint pain, just system-wide issues with people with lupus. And it can be treated pretty effectively, but again, it's going to require suppressing the immune system in those cells that are attacking those self cells of the central nervous system, heart, kidneys, needs to be treated. Myasthenia gravis is another one that antibodies attach and interfere with the muscle cells. So as a result, the muscle cells become overly weak, and the muscle the diaphragm that is in charge of breathing eventually is damaged and can result in death. So that's a very serious autoimmune disease. Multiple sclerosis is a common one, in our area here in the Midwest. We're not quite sure. There's a lot of theories as to why MS is higher here than in other areas, say near the equator, but that's a whole nother discussion. But anyway, it's T cells. It's when T cells attack the myelin sheath covering our fibers in the central nervous system. So looking at the brain and spinal cord, For some reason, the T cells start to attack myelin, and that prevents the flow of impulses in the brain and spinal cord, and as a result, people suffer with numbness, weakness, a lot of problems with bowel and bladder, eventually depression, system-wide issues because of that myelin sheath being damaged and not conducting impulses properly throughout the brain and spinal cord. So there's, again, a lot of treatments for these autoimmune diseases, but it requires immune suppression. So there's always side effects related to treating autoimmune diseases. So we'll pick up in our next video talking about bacteria and viruses and their role in the immune response.